I want to challenge the technology fraternity and biotechnology colleagues in industry to develop a simple test for making a provisional diagnosis of sepsis in a small infant or a newborn and even older children. Very often babies present with symptoms or symptomatology where we are not sure whether the baby is sick, to be transported to the hospital and to be given therapy and IV fluids and antibiotics. You see a sepsis, bacterial infection. Or this is the baby who can be just reassured and sent home and can be provided care by the family under, of course, some way of connectivity with the health system. So it makes all the difference. So sepsis diagnosis, which is point of care and a rapid diagnostic, is the need of the hour. This is the chase that you guys can catch up with because the West has really not produced anything. So we need something which is point of care. It works in the community or homes. It gives me a test status, test response or decision in 15-20 minutes. It could be on a paper strip. It could use blood, urine, saliva, tears, or a biophysical characteristic. It costs less than 15 rupees because you need it so very often that it has to be cost effective. And it could be used by somebody who's class 5 or class 8 pass and gives me a diagnosis at one level, sepsis or no sepsis. At second level, viral or bacterial, because bacterial means antibiotic. And it could be even better, gram positive versus gram negative bacteria, where antibiotic choice can matter. It can also perhaps go further and say, look, don't use the first line antibiotics because this organism is resistant. So it could be antibiotic sensitive or resistant. That's the level of hierarchy that one can hope this product to be increasingly sophisticated. And yet it is point of care. It can be done at home. It gives me the test result in 15-20 minutes and so on. This is one of the grand challenges. I encourage you to look at this because we want not to miss the diagnosis of sepsis, but we don't want to overtreat. Overtreating with antibiotics is A, painful, useless, costly, scary, and B, you are using antibiotics more than what they are really required for, and you are promoting antimicrobial resistance, which is such an important issue.